back, everyone. It's that time of year when you or someone you know is sneezing, coughing, maybe has the fever. Well, how do you know if those symptoms are caused by a cold or by the flu? Dr. Brandon Walser, who specializes in infectious diseases at CHI St. Vincent, is joining us now to help us figure this out. Thank you for being here this morning.
Thank you for having me.
So a lot of times, we will get the, stuffiness, the runny nose, and start feeling bad overall. Sometimes it's just hard to determine what's going on. So how do you really know, okay, should I go to the doctor for this or should I just wait this out?
Right. So the common cold and the flu are both respiratory illnesses, but they're caused by different viruses. But however, like you said, they have very similar symptoms, so it's often difficult to tell. So you'll often get things, the common cold is a lot milder than the flu. So you can get things like fever, fatigue, stuffy nose, runny nose, those kind of things. Whereas with the flu, you typically have higher fever, you can feel much more fatigued. And just that general not feeling well. And so if you have kind of a higher level of symptoms, it's good to see your doctor and get checked out.
So would you say kind of that threshold to cross is fever? Is that really where you go, okay, I need to really go in?
Fever is a big one. It's always good to check with your doctor if you're having that high fever. But I would say probably the biggest one is if you're feeling really, really fatigued with all these other symptoms involved, then there might be something else going on like the flu as opposed to just the common cold.
So when you do go in, if you're feeling crummy, how do you figure out if you actually have the flu? Is there some kind of test?
Right. So if we can't tell by symptoms alone, we do have a swab test that they swab your nose.
Todd was saying it was a little painful.
It's not this long, but it is sometimes a bit uncomfortable. So it's a good idea to get your flu shot to try and prevent having to get the test. So.
Right, absolutely, and that's one of the things we were chatting about is prevention. You wash your hands, but is that really all you can do?
Yeah, so there's some other things you can do. Don't reuse tissues. Make sure you cover your nose with a tissue if you're sneezing. Like you said, wash your hands. Use your hand sanitizer. If you're feeling sick, don't go out and spread it around. Also, if you do have the flu, take the medicines that are prescribed to you.
Now, here's a question for you. Can the cold turn into the flu?
Right. So technically, no, because they are separate viruses. But it's certainly possible that you can be infected with the flu, with the common cold, and have some of those symptoms and then get infected with the flu on top of it. So it is possible that the symptoms can turn from one into the other.
Now, you were talking about some treatments for the flu. Can you talk about what those treatments are and how does that differ from treating a cold?
Right. So with the common cold, we're typically going to treat you symptomatically. So we're going to treat you with Tylenol for your fever, nasal decongestants, cough suppressants, just kind of things to make you feel better. And we still use those with the flu. But if somebody's diagnosed with the flu, we have specific antiviral medications. So Tamiflu is one that a lot of folks out there have probably heard about before that we can use to help treat that.
So I know as we're getting into flu season, a lot of people are worried about getting the flu. Some people are getting their flu shots. Who is most at risk for the flu? Who should be getting their flu shots?
Right, certainly. So the people that we're most concerned about getting the flu are people that are going to have those complications. So things like bacterial infections that can occur on top of it, ending up in the hospital on the ventilator, having respiratory issues, pneumonia, things like that. So those groups are going to be our seniors over the age of 65, children under the age of 2, pregnant women. It's always important to get your flu shot if you're pregnant. Anybody with a problem with their immune system, so that could be somebody who has HIV, or it could be somebody like people with rheumatoid arthritis and lupus that actually take medications, and those medications that treat their condition cause their immune system to be a little bit weaker. And then another large group that we don't think about as often is people with chronic medical conditions, so heart problems, lung problems, liver problems, kidney problems, diabetes. All those things can put you at higher risk for having problems.
So probably the biggest takeaway here is if you are feeling bad, probably better to err on the side of caution. Go ahead and come in and have yourself seen.
Yeah, certainly.
All right. Thank you so much for being here. We appreciate it. And all good information.